Today, I would like to talk to you about few points on sudden cardiac death. I'm Dr. Rajeshwari Nayak, cardiologist from Apollo Hospitals, Chennai. Many of you would have seen people just collapsing and dying. This is called sudden cardiac death. Death occurring within 1 hour of onset of symptoms. By the time these people reach the nearby hospital, it would be too late. Earlier, we used to see sudden cardiac death in elderly people at the age of 60s and 70s. Of late, we are seeing more and more young people at the age of 30s and 20s developing sudden cardiac death. This is truly a alarming trend. Last few years, we have seen many of the celebrities collapsing following exercise or in their workplace. What are the common causes for sudden cardiac death? The commonest cause is coronary artery disease, that is heart attack. Nearly 80% of the sudden cardiac death occurs following heart attack. The other causes are certain diseases which involves the heart muscle, what we call cardiomyopathy, especially hypertrophic obstructive cardiomyopathy or just hypertrophic cardiomyopathy, certain diseases of the valves, certain diseases which are congenital, and diseases which can cause electrical disturbance of the heart, that is arrhythmias. They are arrhythmogenic ventricular dysplasia and long QT syndromes. We are seeing people collapsing following extreme high intensity exercises in the fitness studios or in the sports ground. This occurs as a result of very high heart rate. That is, if a person exercises beyond 150, 160 heart rate, it is too high a strain for the heart. What happens is the heart blood vessel, which may have small thin plaques or deposits of cholesterol, at this high heart rate, this can rupture and cause heart attack. Again, during high exercises, people who have certain conditions which I already enumerated can develop electrical disturbance and they can collapse. People on the sports ground can collapse suddenly because of the underlying heart problem, diseases which I already explained, or because of sudden chest trauma, sudden trauma to the chest, either which is physical or with a heavy ball. This is called commotio cardio. You would have heard people suddenly collapsing following football or other endurance exercises. What happens is, following the trauma to the chest, the heart muscle gets damaged or the person develops a sudden electrical disturbance and people can just collapse. That is why it is important for people who are taking up high endurance exercises or high intensity exercises to undergo a basic heart checkup in the form of ECG, echo and a treadmill test. Consult your physician or a cardiologist and get clearance from them for you to undergo high intensity exercise and also before going for heavy sports. Can we prevent sudden cardiac death? Yes, to a large extent we can prevent sudden cardiac death. How? Taking care of risk factors. The risk factors like high blood pressure, diabetes, smoking, obesity, sedentary lifestyle, poor eating habits, stress, both emotional and physical stress, and avoiding too intense exercises, not allowing the heart rate to go beyond 150, 160 in youngsters, that is below the age of 40, not allowing the heart rate to go beyond 120, 130 above the age of 50 and 60. People who have strong family history of coronary artery disease, that is, if the parent or the first degree, second degree relative has had heart related heart attack or a stroke, that person, the children will have high risk for developing coronary artery disease. All these people should undergo regular health checkup from early age and also take up healthy lifestyle to prevent they developing coronary artery disease. What you all can do when a person collapses and you see a person collapsing? You should immediately do cardiac massage. Just continue to massage the chest, just little bit of left side of the central chest till the ambulance arrives. And you all should know the local ambulance number till the ambulance arrives. Continue to massage. You may be able to save certain lives like this. And learn how to give CPR or cardiac massage. When we say CPR, it is chest compression and mouth to mouth breathing. Even if you do not do CPR, just giving chest compression will suffice many a time. But till the medical personnel arrives, you should continuously do the chest massage. And also when you choose a fitness studio, make sure that there are people who are trained in CPR. In case of any untoward consequences, people there should be able to help the person. So my message to you all is stay healthy, take care of your health, undergo regular checkup, and also learn how to give cardiac massage. There are many YouTube educational videos which will teach you how to do cardiac massage, and by this you will be able to save certain lives. Thank you.